Tired of feeling that deep, aching pressure in your pelvis? Or that sudden, sharp stab that stops you in your tracks? Are you constantly battling the exhaustion that comes with chronic discomfort? Wondering if this pain is just normal for you? Maybe even a sign that you are simply being dramatic. This relentless cycle of pain and doubt is one of the heaviest burdens of polycystic ovary syndrome, a secret, invisible battle fought in silence by so many incredible women. And it steals not just physical comfort, but your peace of mind, your energy, and sometimes even your joy. The exhaustion that comes from always being in pain, or always waiting for the pain, is a unique type of suffering that goes largely unacknowledged. Good news: while this pain is absolutely real and completely valid, understanding its true source is the very first and most powerful step toward finding genuine, lasting relief and beginning to reclaim control over your body and your life, giving you hope that a future with less pain is possible. In today's video, we're going deep into the different phases of PCOS pain, dissecting what each specific sensation might mean, what the underlying biological cause is, and most importantly, revealing the clear, urgent warning signs you should never, ever ignore. So stick around, because recognizing these crucial patterns and knowing exactly when to call your doctor are the life-changing insights that will finally bring you peace of mind and put you on the path to feeling better. And you deserve to feel better. Before we dive in, I'd love to know where you're joining me from today, what part of the world you're tuning in from. Drop a comment below and feel free to ask any questions you have about your experience with PCOS pain. We are here for you, listening and ready to support you. And please, don't forget to hit that subscribe button and turn on notifications so you never miss a health-boosting tip or a moment of support from the Healing Vitality community. First, let's talk about the silent, constant ache that so many of us experience, the frustrating and exhausting reality of chronic pelvic pain in PCOS. You wake up every day, and there it is, a dull, heavy feeling in your lower abdomen, a weight that just never seems to lift, sometimes radiating into your lower back or down your thighs, making the simple act of sitting down or standing up feel like a monumental effort, and it makes you wonder, why me? Why is this always here, always present, always lurking? Why can't I just have a normal day where my body doesn't remind me constantly that something is wrong? We need to understand that this feeling is not your fault, and it is certainly not a figment of your overactive imagination, despite what dismissive doctors or confused friends may have told you. This chronic, low-grade, persistent pain is deeply rooted in the systemic, chronic, low-grade inflammation that often comes hand in hand with PCOS, and it is a battle fought by millions of women globally. So please know you are absolutely not alone in feeling this. When your hormones are out of balance, when you are grappling with issues like insulin resistance, elevated androgens, and the resulting increased adipose tissue, your body is essentially on a low-level biological wildfire, creating a cascade of inflammatory cytokines that sensitize your entire nervous system. Your reproductive organs, especially the ovaries, become highly sensitive, sometimes enlarged due to the presence of numerous small follicles, leading to a kind of constant soreness, a perpetual state of irritation that just won't subside, which is why a simple day of standing or exercising can leave you feeling completely depleted, not just physically exhausted, but emotionally and spiritually drained from the sheer effort of managing that constant underlying pain. And it can feel so isolating because it is invisible to everyone else. The medical world often simplifies this, sometimes even dismisses it as generalized anxiety or just something women deal with, telling you to just take an over-the-counter painkiller, or that it's all in your head because traditional imaging or blood tests don't always show the clear, dramatic cause they are trained to look for. But you and I know the undeniable truth. The pain is real, and the emotional experience of having your pain invalidated hurts almost as much as the physical ache itself. This is why creating context is so critically important, because once you understand that this deep ache is a complex biological response to hormonal chaos and chronic inflammation, you can stop blaming yourself, stop doubting your sanity, and start focusing all that energy on finding the right solutions because they exist and relief is possible. We are simply preparing the ground for hope right now, acknowledging the struggle, validating the suffering, and giving this pervasive discomfort a name so we can tackle it together, one powerful, informed step at a time. And the very first step toward managing this constant low-level soreness is understanding the power of simple, everyday habits that target inflammation and nervous system tension at its source. The first essential step, the one that acts like a gentle internal soothing balm for that chronic ache, is the daily, non-negotiable habit of targeted mineral support and nervous system regulation, focusing specifically on high-quality magnesium and sustained deep breathing. This is not just about drinking more water. If you are dealing with chronic inflammation and hormonal imbalance, your cells are often struggling to properly absorb and utilize the water you take in, and the constant biological stress on your body depletes essential calming minerals like magnesium at an alarming rate. Magnesium is, essentially, nature's most powerful muscle relaxant and nerve calmer. It plays a critical role in over 300 enzyme reactions, including those that regulate muscle contraction and nerve signal transmission, thereby reducing that constant feeling of tightness and general pelvic soreness that pervades the abdomen and lower back. By ensuring you have enough high-quality, bioavailable magnesium, you are directly calming the overactive nervous system and helping to reduce the baseline muscle tension that contributes to that pervasive pelvic pressure. The kind of ache that makes sitting through a movie or a meeting feel unbearable. Can making a conscious effort to boost my magnesium and practice mindful breathing daily really help to reduce the persistent, low-level chronic pain I feel from PCOS? Absolutely, yes, with a resounding confidence, because this approach is addressing the key root causes of that chronic ache: nerve oversensitivity, chronic muscle tension, and systemic stress fueled by hormonal imbalance. And while it's not a magical overnight cure, consistent mineral support and nervous system grounding create a foundation of cellular calm that makes a noticeable and cumulative difference in your day-to-day comfort levels. To put this into practical application, you want to aim for magnesium in its glycinate or threonate form, which are generally well absorbed and calming, taking a dose of around 300 to 500 milligrams before bed, as it profoundly aids in restful, restorative sleep. And you should couple this with a simple practice of diaphragm or belly breathing for 5 minutes, 3 times a day, which actively downregulates your fight-or-flight response, sending a signal to your tense pelvic floor and abdomen to finally relax. You can combine this mineral support with gentle pelvic stretching. Think yoga poses like cat-cow or child's pose, which increases circulation and further relaxes those tense, painful muscles, making this a simple yet incredibly potent daily habit for managing that constant, wearying ache. But that's just the beginning of how we reclaim comfort from PCOS. The next vital step is even more powerful and often overlooked because it involves recognizing the difference between that everyday chronic discomfort and the intense, debilitating pain that demands a completely different approach. Before we continue, if this information is helping you find clarity and a sense of hope, please hit the like button right now and subscribe to the channel so you never miss any of our upcoming tips for managing PCOS symptoms and improving your health journey. Now that we've talked about the chronic, low-grade ache, we must shift our focus to the more acute, often terrifying side of PCOS pain: the severe, life-interrupting period pain, or what doctors technically call dysmenorrhea, and another common sharp pain: ovulation discomfort. The period pain is the one that makes you curl up in the fetal position, the one that forces you to miss work or school, the one that makes you feel dizzy and nauseous, and it's critical to understand this isn't simply bad cramps. For many women with PCOS, this intense pain is often exacerbated by higher levels of inflammatory markers and the potential for a thickened endometrial lining due to hormonal imbalances, which can lead to more aggressive, inflammatory shedding, and consequently, agonizing contractions driven by inflammatory hormones called prostaglandins. This pain can feel like a vice grip, a deep, pulling, contracting sensation that radiates into your entire pelvic bowl, sometimes even down to your knees, and it lasts not just for a few hours, but sometimes for days, stealing huge chunks of your life and leaving you feeling drained and deeply resentful. Beyond that, many women with PCOS experience a distinct sharp pain known as Mittelschmerz, or ovulation pain, which occurs mid-cycle, usually localized intensely to one side of the lower abdomen, lasting for a few hours to a day. And this happens because the ovary, which may be struggling to release an egg due to the hormonal environment of PCOS, sometimes experiences a small, painful rupture of a follicle or capsule during that release, which irritates the surrounding tissue. Have you ever felt like your period pain is so severe it can't possibly be normal? Or have you experienced that sudden, sharp mid-cycle stab that made you worry something serious was wrong, wondering if you're the only one experiencing this level of suffering? This is a crucial question because the answer helps you move from suffering in silence to seeking proper medical intervention. If your pain requires you to take prescription painkillers, if it causes you to vomit, or if it makes you unable to leave your bed, it is unequivocally not normal, and it is absolutely a signal that your body needs targeted support and investigation from a specialist who understands PCOS-related pain. You should not have to normalize being incapacitated once a month. The first key to application here is a two-pronged strategy focused on inflammation modulation. First, you must integrate high-dose omega-3 fatty acids, which are powerful natural anti-inflammatories, taking 2 to 4 grams daily in the 2 weeks leading up to and during your cycle, as this can dramatically modulate the inflammatory response that fuels the severity of the cramps and the ovulation pain. And second, you should utilize targeted, continuous heat therapy, applying a hot water bottle or heating pad to your lower abdomen and back for 20 minutes at a time, several times a day, starting before the pain becomes unbearable, which works by relaxing uterine muscles and increasing blood flow. Talk to your doctor or pharmacist about combining these anti-inflammatory supplements and non-pharmacological methods with prescribed pain management to create a targeted, effective relief plan. Because no woman should have to endure that level of pain month after month, and you deserve to have a life that is not dictated by your cycle. But this discussion brings us to the most critical part of this entire conversation: the absolute red flags and warning signs that move beyond discomfort and into the territory of a medical emergency. Let me ask you something deeply personal right now. How many times, honestly, have you felt utterly and completely alone, unsure of what is truly happening with your body, feeling as though no one around you, perhaps not even your doctor, could genuinely comprehend the depth of your confusion and the constant underlying ache? The constant battle to be believed, to have your reality validated, can sometimes feel heavier than the pain itself. I know how deeply that kind of isolation hurts, and I want you to know with absolute certainty that you are not and will never be alone in this complex, challenging fight. If this feeling resonates with you right now, if you are sitting there nodding and feeling that well of emotion rise up, please do this simple, powerful thing for yourself and for your community. Leave a comment right below this video saying, "I understand this struggle." Type those exact words. Your simple message, your willingness to share your experience, can give immense strength and validation to another woman who is scrolling through these comments, feeling exactly what you feel, and desperately needs to know that she has found a safe space and is not navigating this journey on her own. Your contribution is a beacon of collective support. Now let's look at the absolute red flags you should never ignore. This is the ultimate payoff for sticking with us. The part of the video that is about your absolute safety and well-being. Because while most PCOS pain is indeed manageable, there are distinct warning signs that signal a potentially urgent medical situation, and knowing them instantly can make all the difference between a routine visit and an emergency intervention. The red flags that require an immediate call to your healthcare provider or an urgent trip to the emergency room are characterized by pain that is sudden, sharp, and debilitating, often localized intensely to one side of the lower abdomen, accompanied by other alarming systemic symptoms. Specifically, look out for sudden excruciating pain that is so intense it makes you double over, vomit, or causes you to break out in a cold sweat, especially if this pain appears seemingly out of nowhere, completely disconnected from your menstrual cycle or ovulation timing, as this could potentially indicate a hemorrhagic ovarian cyst rupture, or a rare but critical situation called ovarian torsion, where the ovary twists on its own ligaments, cutting off its own blood supply, and leading to tissue death, which is a medical emergency requiring immediate surgery and intervention. Another critical sign is pain accompanied by a fever higher than 101 degrees Fahrenheit, chills, or unusual, foul-smelling discharge, which could suggest a severe pelvic infection like pelvic inflammatory disease that needs prompt, high-dose antibiotic treatment to prevent long-term complications. Furthermore, any sudden, significant, and unexplained increase in bleeding, especially bleeding that is much heavier than your normal period and does not stop, or pain accompanied by symptoms like lightheadedness, dizziness, and fainting, must be investigated immediately, as these are signs of potential internal bleeding or hemodynamic instability that demand urgent attention. Can knowing these specific urgent red flags truly save my life? Yes, knowing these specific symptoms is an absolutely vital form of powerful self-advocacy, ensuring that when the worst-case scenario or a serious acute event occurs, you recognize it instantly, you state it clearly, and you seek the necessary care without hesitation or doubt, transforming you from a passive patient into an informed, assertive participant in your own health care, which is often the key to receiving timely treatment. This application is purely about documentation and communication. Keep a clear, concise list of these symptoms easily accessible, perhaps taped to your mirror or stored in your phone's notes. And if you ever experience them, state them clearly and firmly to any medical professional you speak to, using urgent, undeniable words like sudden, severe, incapacitating, and radiating to ensure you are taken seriously and receive the urgent attention you deserve. This knowledge is your shield, a vital, non-negotiable step in maintaining control over your health destiny. Before we move into our final comforting thoughts, remember that reinforcing your credibility and confidence with your medical team is a key part of your journey, and it's deeply rooted in understanding the underlying medical evidence and research. Studies consistently show that women with PCOS often have significantly higher circulating levels of systemic inflammation markers, such as C-reactive protein and various inflammatory cytokines, and this chronic low-grade inflammation strongly correlates with the incidence and severity of chronic non-cyclic pelvic pain, confirming what you already know in your gut. The pain is real, it's not just random, and it's certainly not psychological, but a measurable biological reality. This knowledge arms you with the authority to engage in an informed, evidence-based discussion, allowing you to walk into your doctor's office and confidently say, "I understand that my PCOS is associated with chronic inflammation and elevated androgens, and I need a multidisciplinary treatment plan that addresses these root causes, including dietary management and targeted supplements, not just a prescription that masks the symptom of pain." This isn't about being combative. It's about being prepared, articulate, and firm in your truth. And this sense of authority, coupled with a deep human acknowledgement of how much this struggle drains you, is the most powerful tool you have to finally get the proper diagnosis and integrated treatment plan you deserve, which often involves collaboration between a gynecologist, an endocrinologist, and potentially a functional or integrative medicine specialist to tackle all the angles. Knowing this medical link reinforces the entire context of this conversation. You are not weak. You are not failing. Your body is simply navigating a complex hormonal and inflammatory challenge, and the path to relief involves targeted, educated steps, which is exactly why we created this entire safe space. Understanding the why empowers the how, transforming your journey from one of desperate reaction to one of informed, confident action. And that fundamental sense of empowerment is what truly changes everything, paving the way for a future where your pain is managed, understood, and no longer the central focus of your life. If you made it this far, enduring through the difficult parts of this conversation, it means you are searching not just for general information, but for specific, actionable answers, genuine relief, and most importantly, an abiding sense of hope. This entire channel was created exactly for that single, focused, deeply human purpose: to help you truly understand the complexities of your body, to regain that lost sense of control and self-trust, and to find integrated, science-backed solutions that actually work in the real world, beyond the confusing and often conflicting advice that only leaves you feeling more lost. You are absolutely not alone here. We are tirelessly building a safe, warm, and trustworthy space where women just like you can find the honest support, the accurate, validated information, and the deep human connection that makes a real, tangible, daily difference in your life. If this is the kind of guidance, empathy, and unwavering support you've been searching for, please take that moment right now to subscribe to the channel and turn on the notifications so you can walk this path with us, fully informed and fully supported. Every single video we share is a carefully crafted, intentional step toward a healthier, happier, and much more comfortable you, and we can't wait to see you there, stronger, more empowered, and finally, at peace with your body.